Hi, everyone. I have a great episode for you today. I'm interviewing McCall McPherson. She is a PA and the founder of Modern Thyroid and the founder of Modern Weight Loss. We talk about her personal health transformation and journey and what got her into the world of managing thyroid symptoms. We talk about how so many women are kind of gaslit from medical providers when they're coming to the medical providers with all these symptoms: weight loss, fatigue, brain fog, hair loss, skin issues, and they get their labs drawn and their labs look normal. She talks about how she deals with patients like this every single day who come to her from other doctors or medical professionals with no answers, that everything just looks normal. Today, we talk about why your thyroid health is a spectrum and within normal limits versus optimal limits. We talk about exercise and autoimmune dysfunction and so much more. I hope you enjoy this episode. I sure did. I learned a lot. Without further ado, here is McCall. McCall, you have had your own health transformation, and I want to start here so that people can really understand where you've been and why you're so passionate about educating about the things that you do.
Yeah. So really, everything sort of came to a head when I was 27. I was already practicing as a physician assistant in what I thought was my dream job and could not go to work and be out of bed every day. So I would go to work. I'd come home at like 3:30, and I would literally go to bed. I was in bed from that time until the time I had to go back to work. Weekends were spent the exact same. I was already diagnosed with a thyroid condition on Synthroid. So naturally, I knew enough about medicine, right, to know, okay, well, all of these symptoms I'm having of fatigue and brain fog and weight gain and hair loss and low mood, depression, all these things are thyroid symptoms. It's my medicine. My medicine just needs to be adjusted. So I went to my primary care doc and was like, hey, I'm not feeling well. Can you please help me? Can we run labs, do the whole thing, adjust my medicine? He's like, sure. So he runs my labs, he checks the TSH and is like, it's perfectly normal. Actually, we need to reduce your medication because your TSH is too low. And I was like, please do not take another thing away from me. If I lose any more function, I will not have a job anymore. I won't have a marriage anymore. I already didn't have a social life. So anyway, I left feeling defeated, did a bunch of research, came back, handed him a Post-it and was like, can we please run a full thyroid panel? And he was like, let me do some research. And said no. Left there desperate, could hardly function to find my next alternative. Eventually, I found a physician in Austin that dealt with thyroid conditions and had for a long time. He's no longer practicing and waited months to see him, saw him, and I got my life back in 2 weeks.
2 weeks?
I wasn't completely back to normal, but yeah, the light switch came on and I was well on my way. So very, very quickly, he became a mentor to me, taught me everything he knew about thyroid. I absorbed it all, put it into my own practice, which was at the time psychiatry. And in my tiny little psychiatric practice, I started getting a huge influx of thyroid patients. And I'm like, this is weird. I've never advertised myself as a thyroid person. And apparently so many people with treatment-resistant depression that had a thyroid problem spread my information all over the internet on patient advocacy platforms that they turned my little psychiatric practice into a thyroid practice. And when my first patient flew in from out of state, I was like, oh my God, I'm doing the wrong thing. This is my calling. And that's how Modern Thyroid Clinic was born. And now it's the classic pain to purpose story of me taking my pain. And now I get to help women all day, every day who are also blown off by their doctors and told it's in your head. You need to eat less, exercise more. It's not your thyroid. Your labs are normal. I get to help all of those women get their lives back. And it's just sacred.
Incredible. What were the things that you did right away that caused such a that you saw changes within 2 weeks? What were the changes that you made?
Yeah. So it's kind of the way that I still practice medicine to this day. It was purely medication and biochemical related in the beginning. And that's kind of how I operate with my patients. It's like they come in, I analyze their biochemistry, and then we work to fix that. So I got switched from Synthroid to Armour. Armour Thyroid is a combination medicine of inactive and active thyroid hormone, whereas Synthroid levothyroxine, the number one prescribed medication in America, is all inactive hormones that a lot of people cannot activate. So they're just stuck endlessly with thyroid symptoms, taking a medicine their body can't use. And that's kind of how I work with my patients too. We build from that platform. That is a quick way to give people the energy, the capacity, the motivation to pour back into their lifestyle to create more energy, right? Like when you're not stuck in bed all day, you can actually eat better. You can move your body. You can do all the other things that is required for you to feel vibrant and healthy. And so that was my start.
Yeah, you got to get started somewhere, and then the benefits can snowball.
Yeah.
So you kind of talked about some of your symptoms.
Mm-hmm.
Is that pretty common in people that don't have thyroid issues? Do you think if someone's like, I wonder if my thyroid isn't optimal, quote unquote, what symptoms should they look for?
Yeah. So there's kind of two parts to that question. So the symptoms that you should look for are, and I say, look, if you have 5 or 6, you really need to get a proper screening. Fatigue, weight gain, or just like inability to lose weight, cold intolerance, hair loss, hair breaking, nail breaking, loss of the outer portion of your eyebrows, being told you have high cholesterol or high blood sugar. The doctor that saw me initially tried to put me on Lipitor as a 27-year-old person for my high cholesterol that was literally due to my thyroid problem.
Wow.
Side note, low libido, depression, cracking on the bottom of your feet, all of those types of things. I don't think I have brain fog if I forgot that one. But those are symptoms of thyroid. Regular medicine tries to paint a picture that these are non-specific symptoms, that we shouldn't be investing in patients and checking full thyroid panels because they're too non-specific. If their TSH is fine, it's not their thyroid. That's not true. It's wildly outdated. And in fact, my perception is skewed, right? Because people that come to see me, they generally do have a diagnosed thyroid problem, or they've been told it's not their thyroid. And in fact, it is. So I would say if it looks like a duck, it walks like a duck, it quacks like a duck, it's probably a duck.
Right. Well, because when I was in high school and college, I went to, I can't tell you how many doctors with chronic fatigue and brain fog and memory issues. And I got diagnosed with ADD and got put on like Adderall. I had a lot of doctors tell me like, oh, it's just your stage of life. Like you're just like, it's just because it's your lifestyle, la da da da. And it's still to this day, it's improved a lot, but I think I've done all of the lifestyle things to compensate. Like I really dialed back drinking. That's helped me a lot. I have to be so dedicated to my sleep.
Yeah.
If I'm not, like I am on, it's bad.
Yeah.
And it can spiral quickly. And so it's always made me, hearing you say all of this is making me be like, did doctors just tell me like, okay, your panels are within normal range, and so therefore you don't have an issue? So talk about within normal limits versus optimal.
Yeah. First of all, you need to come see us because tired people are our people. Like that is like the thing that we deal with all day, every day. Tired women, right? And our success rate is really, it's unparalleled. And so if you're tired, come, let us help you. Oh my God, I
can't wait to come.
Yeah, let us help you. So there's 2 kind of layers to this issue. Number 1 is doctors are only checking TSH to screen people for thyroid dysfunction. And TSH is a wildly unreliable marker, full stop. Full stop. So if someone's TSH is normal and they have symptoms of hypothyroidism, they need a full thyroid panel. They should have that in the first round of labs, but minimally, like do it the second round, which includes TSH, free T4, free T3, reverse T3, and TPO and thyroglobulin antibodies to screen for Hashimoto's. So that's like layer 1, and that's not happening. Everyone is only getting their TSH or their TSH and their T4 checked, and those 2 numbers are directly related to one another. Does not tell you a thing about how much usable thyroid hormone you have in your body, because that's free T3. So that's number 1. Number 2, there is actually, and this is mind-blowing, there is no standardized range for what is normal with thyroid. in medicine, we don't have a set range. So what's happening is doctors are looking at a lab sheet and they're simply screening it to see if anything's in bold or off to the side. If it's not, they say it's normal.
Oh, wow.
The problem with that is that every lab, their definition of what is normal is different. So even LabCorp close to here is different than LabCorp's ranges close to my office.
Wow.
Yeah. So now we are depending on the lab to determine what is normal. And that lab is simply taking averages of people in their system. So, like taking out the extremes, right? But they're averaging a bunch of sick people and saying, okay, this is optimal. Well,
What?
no, like people that go to the lab are not going because they're like, you know what? I feel great. I wonder what my thyroid looks like today.
Wow.
You know, they're going because they feel sick.
Yes.
So now we're basing optimal and normal, quote, normal lab ranges on sick people, even including people with the condition we're trying to rule out, which from a data standpoint makes no sense.
Makes no sense.
Yeah.
That is extremely eye-opening.
Yeah.
Do you think that this is more of a systemic issue than what is getting diagnosed? And if so, why?
You mean systemic in medicine or systemic in the person's biology?
In medicine, like
Oh, yeah.
in our country or in the world?
Yeah. So it's definitely a systemic issue. I think part of it is rooted in the fact that medicine is not grossly invested in the health of women. Most studies are done on men. Women are kind of pushed to the side. We're often gaslit, written off as, you know, well, you're just tired because you have kids. And then it's you're just tired because you're pregnant and then you have kids and then you're breastfeeding and then your kids are in elementary school. And then women come to see me. They're like, all my kids have graduated from college. I have no reason to still be tired. And I'm still tired. So that's part of it. The other thing is our training in medicine grossly oversimplifies thyroid conditions. Like the investment into that condition is extremely poor, and endocrinologists are hyper-focused on diabetes. They're not invested in thyroid. Mm-hmm. The diagnosis and the treatment is oversimplified. Clinicians are never trained how to use any medications except levothyroxine-based meds, which again, do not work for a huge percentage of the population.
Wow.
Yeah.
This is nuts. Where does pregnancy play into this? Because does pregnancy affects your hormones? Mm-hmm. And I was just pregnant, so I'm like always interested in this.
Yeah.
Where do you see more of an issue, less of an issue when people are pregnant, or is it the same?
Yeah.
How does that change?
So I'll tell you kind of pre-pregnancy, T3, which is your active thyroid hormone that no one's checking nor addressing, is extremely important. Your ability to get pregnant and maintain pregnancy, especially early on. So, and even like TSH, other hormones, they have to be really tightly optimized so that women can get pregnant quickly, easily, not be at risk for miscarriage. Throughout pregnancy, our demand for thyroid hormones increases. So if you're already kind of teetering on that line, you can get pushed over into the functional hypothyroid state. And then postpartum is the most common time women experience Hashimoto's, which is the autoimmune condition associated with your thyroid. Mm-hmm. And most women are not screened postpartum. If they have depression, anxiety, they're not screened for Hashi, for thyroid dysfunction, for hormone dysfunction. They're just kind of like, well, your option is like push through or take an antidepressant. Yeah. No root cause approach.
Yeah, I got no questions from my postpartum visit about that at all.
Which is, again, like so sad. The one place that women should be safest in medicine is in the OBGYN's office.
Yeah.
Right?
Yeah.
Like we should be nurtured and cared for, and we're not even getting that there. So where else are we going to get it?
Right. And I know it's not always the doctor's faults because they have such little time with their patients,
right.
and they got to kind of do the low hanging fruit to make sure that she's just okay.
Yeah.
We're at okay. We're not at optimal or your best.
Right.
We're just like survive.
Yeah.
Which is terrifying.
Sad.
Yeah. Wow. This is really interesting. Exercise in autoimmune.
Yeah.
So this is really interesting. We got a email from one of our members, and our platform is strength training focused. Mm-hmm. And she was diagnosed with an autoimmune condition. And she was seeing rheumatologists, functional medicine doctors. The functional medicine doctor recommended light weights, high rep training. Mm-hmm. She asked why. He didn't really give a good response. 2 rheumatologists that she saw. The first rheumatologist said, she asked about weight training. And he said that weights will make her body, I'm reading this, quote, bulky and puffy and not feminine because of systemic inflammation. And her second rheumatologist did not recommend weight training either. And she said that none of these doctors could explain why. And this is a little alarming to me.
Oh, I bet.
Because I'm like, what? These are doctors that you're trusting with your health.
Right.
And they're recommending that you basically avoid building muscle and strength.
Right.
What do you have to say to this?
I mean, I could quote Dr. Gabrielle Lyon and say muscle is the organ of longevity.
I completely agree.
As we age, we lose muscle and we lose our opportunity to effectively build it as well. And so it is so incredibly important for women in their 30s and 40s to build muscle because we can propagate and continue to build it and maintain it in our later years when it's even more difficult. But huge risks for early death, even in 60s, is falling, right? And you have to protect yourself from that. So I actually feel 180-degree opposite. So people with autoimmunity, autoimmune thyroid conditions, most of them have some level of adrenal dysfunction. Their adrenals have been compensating or activated because of their autoimmune disease or their low-functioning thyroid for years. And so they get kind of worn down from use and overuse, okay? And so we don't want to grossly overtax our adrenals while we exercise. And things that do that are like HIIT, CrossFit. Those things can really tax someone who's already vulnerable, tax their body too much. What doesn't tax your body too much is building muscle, right? Mm-hmm. Lifting heavy. Now, you don't need to lift heavy and do a circuit training where it's like back to back to back and your heart rate's up and you're exhausted by No, like I really encourage people, especially early on in their work with us, and to lift weights, go slow, take long breaks in between, but build muscle. And then separate from that, walk.
Yeah, I love that. So you recommend in the beginning, take out the like boot camp type classes. Can you elaborate more on that?
Yeah. So honestly, some of the only people that we can't fix at Modern Thyroid Clinic are people who come in but before they come in, they're already vulnerable, adrenally speaking. And then they try to exercise their way out of their fatigue. So they exercise, and at first it starts as, after I really do intense workouts, I feel kind of tired later in the day. And then it progresses to, I need a nap later in the day. And then they continue to push through. And then they feel sick after they work out. And then they work out and it takes a week to recover. And that's a really dangerous slippery slope. Mm-hmm. And truly, sometimes I can't help those people. It's too late at that point. And so that's always what I'm trying to protect people from. And sometimes really athletically minded people, they're push through people.
Yeah.
Yeah. And so they can be their own worst enemy because they'll just push. And instead of getting stronger, they're getting weaker. Their physiology is breaking down more and more.
That's what I always try to educate on is we are taught from the fitness industry that more is better, the sweatier, the better, the more calories, the better. And that's not necessarily the truth.
No.
And if your workouts are poor quality and you're just grinding your body into the ground and you can't recover, then it's not going to actually be an effective routine.
Totally.
And I think the piece about hormones is very confusing to people.
Yeah.
Because they think that, it's an overdrive of cortisol or too much cortisol. How does cortisol play into all of this?
Yeah. So basically, cortisol is directly related to the adrenal function. And so, initially when your adrenals are overworking, they're secreting extra cortisol. That's usually not what's happening by the time people are getting worn out from their workouts. They usually don't have enough cortisol. Their cortisol is flatlining. It can't keep up with daily demand, especially in the afternoon when naturally our cortisol drops. they just crash and burn. Their adrenals can't keep up with demand. Then you throw them in a CrossFit class or boot camp. Their adrenals are trying to mount this response so significantly. And eventually they just can't keep up. And that's what can lead to, in functional medicine, we call it adrenal fatigue.
Yeah.
Regular medicine doesn't believe in adrenal fatigue. I've described it as this for years. And I heard a physician say this a couple months ago. Your adrenals work perfectly, or you go into adrenal failure and you have Addison's disease. There is no in between, which that's not how really anything works.
Nothing.
Much less in our body. We have two adrenal glands too. So like both of them are failing simultaneously at the same time. No, there's a process of breakdown. And that's what functional medicine calls adrenal fatigue. And that is where exercise, overtaxing your body can compromise your adrenals pretty heavily.
Wow. Where does diet play into this?
Yeah. So, I think it's too women, especially like women my age, I would say, and older, we are taught like restrict. That was like ingrained into our body, into our minds as young kids. You want to be thin. You don't want to, you want to exercise and eat a little bit. No, we need to fuel our body. Like we have to fuel our body to produce muscle mass. Our body doesn't just magically produce muscle mass if we're not getting the fuel. We need the micronutrients to recover. We need the micronutrients to have, resilience against oxidative stress. So we have to give that to ourselves. No one's going to give it to us for us. So we have to fuel our body. It's, I think, foundational.
Yeah. What about, we talk a lot on the podcast about protein. What are your views? If someone is coming to you with an autoimmune issue or thyroid dysfunction, what do you recommend from a nutrition standpoint?
Yeah.
And where does protein play in?
Yeah. So and a lot of our people have metabolic dysfunction, right? Like if you have a thyroid issue, most people have metabolic dysfunction and their metabolism is pretty damaged by the time they come here. So we anchor basically everything with protein. And I talk a lot about what I call ordering your food. And I don't mean like takeout. I mean, like I have my patients start every meal with protein and then move to nutrient dense foods that are low glycemic index and then move to carbs.
Okay.
Yeah. So from, a blood sugar standpoint, the protein lays the foundation to not have an overreactive blood sugar swing. It also allows your body to keep your blood sugar lower longer. I even encourage people to do protein, heavy micronutrients for the first meal or two of the day. Save their carbs for the evening so that even though they're not particularly fasting during the day, their glycemic index their blood sugar, their insulin is staying low until dinner. Then it increases and then they have all night for it to reset again.
Why is blood sugar important when you're managing thyroid dysfunction or autoimmunity?
Yeah. So blood sugar is so important for everything. I think your insulin sensitivity is one of the most important markers for longevity, how long your health span, your lifespan, all the things. People rapidly lose their insulin sensitivity with a thyroid disorder in particular. And their blood sugar raises, their insulin raises, their leptin increases. So now they're storing more fat, they're feeling more hungry, and it very quickly spirals into loss of metabolic potency and their metabolism no longer functions appropriately. So whatever we can do to prevent the propagation of that and also reverse what's already happened is key. Otherwise, women can't lose weight. They can hardly maintain their weight. And insulin, blood sugar, all of that in excess drives inflammation as well,
Well, and going back to muscle, right? Having more muscle improves your insulin sensitivity.
Totally.
And if insulin sensitivity is at the root of so much of this, that's what's wild to me. Like, why are doctors not recommending to build muscle? It's just insane to me.
It's like they are stuck in the 90s.
Yeah.
It's
totally.
Like they're stuck in the food pyramid that's based in highly processed inflammatory, carbs as like the basis and running and HIIT exercise, but no weight training.
Right.
Like we have got to change that. And it's sad. Research shows in medicine, it takes 17 years for new research to come out before it's implemented into clinical practice. Yeah. I would say it's probably honestly longer than that, but that's what studies show. So the doctor that learned their practice of medicine learned it from their mentor, their preceptor, their, chief resident. Now we're just generationally passing on outdated medical knowledge.
Yeah. Well, and I know there are, I'm not sitting here like throwing shade on doctors and physicians. And I think there are many of them who do a really good job in
keeping up,
yourself included, and keeping up. But I always caution people when they come to us like, oh, my doctor said, like, we had another comment of someone said, my surgeon recommended light weights, like the women are doing in Europe, toning exercises like the women are doing in Europe. And I was like, what? Like,
what even is that?
It was curious. Wild to me. And I just wanted to say, your surgeon is trained in surgery. Awesome. But a lot of these doctors are not trained in exercise physiology. They're not keeping up with all of the latest research about it.
None of them. That is not part of medical training.
Right.
Nor is nutrition. Like, that's just not what's happening in medical school.
It absolutely should be, in my opinion. But they have so many things to learn. Again, thank goodness
and
for
surgeons
Western
don't
medicine.
have to give exercise advice.
No.
So they shouldn't, although they shouldn't give it then if they're not trained in it, but
no,
they're not required to learn all of that. That's why we have a team-based approach to medicine. But definitely, I wouldn't blatantly give patients advice if you're not equipped to give it either.
Agreed. And a lot of them refer to physical therapy, and maybe your physical therapist is someone to take advice from with fitness.
Right.
So this is awesome. If you had to leave the listeners with some kind of parting wisdom, or maybe some myths that you get, or question, like a common question that you get on Instagram, what would that be?
Well, one thing is, I think there is a misconception propagated that women with thyroid conditions are just bound to be tired for the rest of their lives and miss out on the enjoyment of life and be stuck in this survival complex. And that's not true. I mean, our whole approach at Modern Thyroid Clinic, our whole tagline, what we believe in is there is no reason to still have thyroid symptoms. And so if you are a woman and you are being treated for a thyroid condition and you're being told that this is normal, that you're exhausted and you have no libido and you're everyday surviving, just getting through until you can get to bed, that is not what your life has to look like. If you're a woman and you're being told you don't have a thyroid problem, do not trust that that is the truth, because our practice is filled with 100% of women who have been told that their thyroid was not their problem. And those women have gone on to get their lives back and thrive and have an incredible sense of vitality. So you have to be your own advocate, especially in the world of thyroid dysfunction, thyroid symptoms. You cannot place that in the hands of your clinician, doctor, etc., and trust what they say as truth. Not yet, in medicine at least.
Not yet, but hopefully people like you are stirring things up enough to change.
I hope so.
Yeah. Thank you so much for being here. How can we find you, work with you? You've got a great Instagram, podcast. Tell us all about it.
So Modern Thyroid Clinic is expanding nationwide. We are in about 30-ish states right now. We'll be in 50 in the next few months, which I am so excited and grateful for.
That's amazing.
I know there will be no corner of our country that will be left unserved for women who need help. So that will be a huge accomplishment for me.
Oh my gosh, congratulations. That's incredible.
So you can find us there. You can always find me on Instagram at Modern Thyroid or McCall McPherson PA. I love TikTok too. TikTok's like my place.
Oh, good.
So find us there. And my podcast is called Modern Thyroid and Wellness. And I'm going to have you as a guest soon.
Yay.
So I'll share a free thyroid lab guide. So what labs you need and what they mean. You can put it in your show notes.
Yes, I will do that.
It's free. People can download it. It will tell them exactly what labs they need to get run, and then our optimal ranges at Modern Thyroid Clinic that we use all day, every day.
Excellent. Excellent. This is super helpful. Thank you so much for being here.
Thank you for having me. This was delightful.
Yay. All right, listeners, we will see you all next week. Same time, same place. Bye for now.